Hey, welcome! Today, we are going to tackle a huge topic that affects millions and millions of people all over the world. But it's one that a lot of us don't fully understand. We're talking about high blood pressure, also known as hypertension. In this explainer, we're going to break it all down: what it is, what those numbers actually mean, and probably the most important part, what you can do about it. So, let's just dive right in. So, to get us started, I want you to think about this question for a second. What medical condition is so common, but also so sneaky, that it's actually earned the nickname the silent killer? You probably guessed it. The answer is hypertension. And we're about to find out exactly why it gets that scary name. So, what even is it? I mean, at its most basic level, a high blood pressure is really just simple physics. It means the force of your blood as it's pushing against the inside of your artery walls is just consistently too high. The best way to think about it is like a plumbing system in your house that's running under way too much pressure, 24/7. That constant strain is going to cause problems eventually. Okay, let's demystify those two numbers you always see in a blood pressure reading. Like 120/80? The top number, that's your systolic pressure. Think of it as the peak pressure right when your heart pumps blood out to the rest of your body. The bottom number, the diastolic, is the pressure when your heart rests in between beats. So it's basically the rhythm of work and rest for your entire cardiovascular system. And this right here brings us back to that nickname, the silent killer. You see, this is what makes it so dangerous. Unlike a broken bone or a nasty headache, hypertension usually has zero warning signs. Most people feel totally, completely fine, and they have no idea that all this damage is quietly building up inside their bodies. So if you can't feel it, how in the world are you supposed to know what's going on? Well, the only way is to understand the numbers. So let's do that. Let's decode your blood pressure and figure out what those numbers are really telling you. All right, take a look at this chart. These are the official categories. A normal reading is anything below 120 and below 80. Simple enough. Now, elevated is when that top number starts to creep up, even if the bottom one is still normal. This is a huge warning zone, and millions of people are in this category. But now look at stage 1 and 2. See that word or? That is so important. It means if either your top number or your bottom number is in that range, it counts as hypertension. Both numbers matter a lot. And then there's this. If you ever see numbers at or above 180/120, this is not something you just watch or manage over time. This is what's called a hypertensive crisis. It's a true medical emergency, and it means you need to get help right away to prevent serious damage to your organs. So, understanding the numbers, that's step 1. Now let's get into step 2, the problem. We're going to look at what causes hypertension in the first place and what the long-term dangers really are. When we talk about causes, they really fall into two big groups. Over on the right, you have the things you can't change, the non-modifiable factors. We're talking about your family history, your age, your genetics, things that are just part of your story. But now, look at that list on the left. These are the controllable factors. This is where your power is. Your diet, how much you exercise, your stress levels. These are the levers you can actually pull to make a real difference. And why is pulling those levers so incredibly important? Well, because this is what's at stake. Unmanaged high blood pressure is a direct pathway to some of the most serious health problems we face. It damages your arteries, it forces your heart to work way too hard, and it puts a massive strain on your vital organs. This isn't just about a number. It's a real threat to your heart, your brain, your kidneys, and even your eyesight. Okay, that was the problem. It's serious stuff. But now let's pivot to the solution, because the good news is hypertension is highly, highly manageable. Let's talk about your management and treatment plan. But before we even get into talking about medication, we have to start right here. This is the absolute foundation of managing your blood pressure. Lifestyle changes are not just some secondary suggestion. They are, without a doubt, the first and the most powerful line of defense you have. So what do these changes actually look like? Well, here they are. It's a pretty clear checklist for a healthier heart and blood vessels. Cutting back on salt, loading up on whole foods, just moving your body more, managing your weight, and, of course, limiting things like alcohol and smoking. Every single one of these is a proven tool for lowering your blood pressure. Now, sometimes lifestyle changes just aren't enough on their own, and that's okay. That's where modern medicine comes in with some really powerful tools. Your doctor might prescribe something like diuretics, which help your body get rid of extra salt and water, or maybe other meds like ACE inhibitors and beta blockers, which work by relaxing your blood vessels. It's all about easing your heart's workload. This isn't a one-size-fits-all thing. It's about working with your doctor to find what's right for you. And that really brings us to the most important message when it comes to management. Consistency is everything. It means taking your medication regularly if you need it, checking your numbers at home with a blood pressure cuff, and just keeping an open, honest conversation going with your doctor. This proactive approach is what turns a diagnosis into a condition that you have under control.
Okay, so we've spent a lot of time on management, but what about stopping hypertension before it even starts? Let's talk about your best defense, prevention.
Hey, does this list look a little familiar? It absolutely should. The keys to preventing high blood pressure are the exact same healthy habits we just talked about for managing it. Keeping a healthy weight, staying active, and eating a good balanced diet, these things don't just treat high blood pressure, they can stop it from ever becoming a problem in the first place.
So we're going to end with this. You've seen the risks of this silent condition. You've seen the clear, actionable plan to both manage and prevent it. All of that knowledge is incredibly powerful, but it all boils down to one simple final question for you. Do you know your numbers? Because knowing them, that is the first and most important step to taking control of your health.